I'm Dr. Ty Vincent. This is another video about low-dose immunotherapy. We're going to talk about how to prepare for your initial consult with me. So whenever anybody works with us directly, the first thing we do is I have about an hour-long Zoom-based consultation with you where I want to know your whole story. And that's honestly the most important thing to me is your story, getting it in real time from you as you tell your story, and kind of we intuitively figure out what information seems the most relevant and what doesn't. And I have a lot of questions that I ask that you may have not been asked before by other doctors. Most of the time when doctors are asking you questions, they're trying to come up with a diagnosis. That's the way doctors are taught in the modern era, is let's make a diagnosis, let's put a name on your condition, and then there'll be some list of drugs that we use to treat that condition. With low-dose immunotherapy, all the questions I ask, all the information that I gather is really geared towards me trying to identify what sort of antigen trigger, like what target of your immune system might be responsible for your symptoms. And so the way you think about that is very different from the way we think about conventional diagnoses in conventional medicine. So I will have to ask you lots of different questions that you hadn't really thought about before. Because of that, people will have typed up written medical histories that can be very long, and they will send them to me ahead of time. I will tell you, I really don't read those. One reason is it's on paper. It's not as good as getting the story organically, dynamically. Two is people don't know what's important, and I always have more questions about what they write down than what they wrote down. It's incomplete, it's not adequate. If you want to send that ahead of time, it's totally useful because it's nice to have a well thought out, detailed medical history in our record. If I do want to refer to it later, that information can be useful. But getting a story from a human being in real time where I can ask questions and I can get a sense of how serious things are from the way you tell me the story, that's actually the most meaningful thing. So you don't have to prepare much for the talk in terms of that, but people will often take the time to set down a timeline, because a timeline is important. Like if something happens after something else, then it could have been caused by that something else, right? So the order of events can be very important for me. When exactly things happened, like was it December, was it October, was it 2005, was it 2007? That's not so important. Don't struggle to try to get dates for things. The order of events, however, is something that I would like to know accurately if possible. Laboratory tests, people who work with us have usually spent thousands of dollars on all kinds of different creative laboratory testing over the years. Most of it is not helpful for what I do. And I'll talk later, I'll do another video about tests in general and why they're not super helpful, but it's just that laboratory testing does not really tell you what's causing your problem. It can tell you if you have elevated antibodies to a certain thing, but it doesn't mean that that's the thing causing your symptoms. Because people who have immunological problems will have elevated immune responses to everything or many things, and it's non-specific. So a lot of people that I work with that have immune issues, they've done all this testing for antibodies against different viruses, bacteria, tests for Lyme disease, stool tests to see what's living in your gut, all these things. They're just not helpful. That information does not usually lead to the answer to your problems. And if it did, you probably would have solved your problems with those other practitioners and you wouldn't need me. So don't stress too much about laboratory data. If there are certain tests that I think are meaningful for your condition, I'll ask for those results. And if you have them, great. And if you don't, it's okay. Like we have a way of approaching everybody's problem, whether we have that data or not. So really, you just kind of need to be ready to tell your story and to answer the questions that I will have along the way. And it just sort of flows naturally and organically when we have that discussion. And we usually, within an hour, can do a pretty good job of figuring out where to start. Like the key things we need to decide at the first discussion are what antigens do we want to try first? And I usually come up with a list of possible antigens that I think we might try if the first 1 or 2 or 3 doesn't work. And then what starting dilution. So those are the things we need to decide after the first visit. The antigens and starting dilution, and all the questions and discussion lead in that direction. And so don't overthink it. You don't need to spend a lot of time preparing. You just need to be ready to tell your story and develop a rapport and ask whatever questions you might have about LDI. So for that purpose, the other thing you should do for prep is read our handout that we will send you when you schedule your appointment that tells you a lot about LDI and dose reporting and all that stuff. Read that ahead of time. Watch all the videos that you think are relevant to your particular case, the basic ones like this, and disease-specific videos, so that you understand what we're doing. And that way you don't have to waste some of your consult time asking me questions that could have been answered satisfactorily by watching the videos and reading the handout. That'll save you time and money.